The World Health Organization last year reported kidney disease as one of the major non-communicable diseases commonly caused by diabetes. Among the most affected are children between the ages of 10 and 25 in Kenya. In order to prevent this from becoming a national crisis, in attendance was the Cabinet Secretary for Health, Mr. James Macharia, who said that this is a great milestone in the health sector. He reiterated that the government is willing to support the health section and encouraged other partners to chip in so as to ease congestion of kidney transplant.
I want to encourage my fellow Kenyans to make positive changes to their lifestyles in order to promote their health and wellness. The launch of this pediatric kidney transplant program is a great step towards transforming the lives of numerous families, and I specifically take this opportunity to thank Kenyatta National Hospital and the KCB Foundation for this noble objective and initiative.
Dr. Doris Kinothia said that the neglected group, including the children with no say, should be given equal priority and get the chance for transplant. This being the first transplant, she said it was no longer a nightmare for parents with children with such conditions. Mary Nginyo, one of the beneficiaries of the kidney transplant, was very delighted, expressing her happiness towards this project. She urged the government to reduce the cost of drugs in Kenya so as to make them affordable for all patients.
Today is a good day. I celebrate everybody, but we have a special person in our gathering, and this is the Cabinet Secretary. As a post-transplant patient, I will request you, Mr. Cabinet Secretary, to make drugs cheap or go into a partnership with Novartis as a manufacturer so that we can afford. Otherwise, the effort that these doctors and these surgeons have done will be futile, because if I miss a drug, every day I take in the morning and in the evening, my graft will reject if I don't.
KCB Foundation, among others, was in support of the charitable projects, where so far it has invested 600 million Kenyan shillings into various projects in both Kenya and Tanzania. They, however, took the challenge to help improve the health sector in our country in support of this program.
KCB Foundation, KCB sets aside 1% of its earnings to support communities, and one area of that is around the health sector. And we're leading in a number of institutions, and I like the challenge you raise. We're seeing good progress. So I want to go back to Professor Antonio, that we're seeing a lot more institutions coming along to be able to allocate resources to finance long-term challenges in community, what you call social investments. And KCB, this investment is not a moment in our life, in our history. It's a journey that we started many years ago. The foundation has been there since 2007. As the group grows, our share of investment in the foundation continues to grow.
Agnes, Maina, GBS News.